Good evening, everyone, and welcome to the VA Ann Arbor Healthcare System Facility Teletown Hall. We're glad you're joining us tonight. This event is designed to give you all a voice. Your thoughts, experiences, and concerns truly shape the care we deliver. Our goal is to ensure your healthcare experience is positive, transparent, and informed. If you are joining us by phone and become disconnected, you can call back at 866-641-6898. That phone number again is 866-641-6898. If you prefer to stream the event online, you can visit access.live/Ann Arbor VA. That's access.live/Ann Arbor VA. My name is Chris Arbino. I'm the Communications Chief with the Public Affairs Office here at VA Ann Arbor, and I will be the moderator for this evening. Joining me as panelists are Dr. Jenny Kreisman, Medical Center Director, Dr. R.J. Schildhaus, VA Ann Arbor Chief of Staff, Dr. Gabe Solomon, Associate Chief of Staff for Informatics, Mr. Dan Weir, User Role Assignment Coordinator, Clinical Informatics, Ms. Nada Archie, Associate Chief of Pharmacy, and Cindy Baker, a patient advocate. Tonight's event is interactive, and we encourage your participation. To protect your privacy, questions will be read aloud by me, the moderator. To submit your question at any time, press *3 on your phone. You'll be connected with a member of our team who will take your name and question. If you're joining us online, go ahead and type your name and question right below the streaming player. We'll also be asking a couple of interactive poll questions tonight during the call, and we'll let you know exactly how to respond when we get to those questions. And with that, I would now like to hand it over to Dr. Jenny Kreisman, Medical Center Director at VA Ann Arbor Healthcare System. Dr. Kreisman?
Thank you, Chris, for this opportunity, and welcome everybody to the VA Ann Arbor Healthcare System Teletown Hall. I appreciate you coming on and providing us with some feedback as we move forward in this new endeavor. This evening, we're going to talk a little bit about the federal electronic health record modernization. As many of you know, the VA was one of the first to actually create an electronic medical record. And it was marvelous, but it's been about 25 years and it's time to update. So we've looked around, and a couple products we've looked at, but we've got a new product that we're going to be implementing here on April 11th. And just to give you a couple ideas of what it'll bring to the table, one is it'll help us work with our DoD partners and bring in your information and maybe support you in a more effective process as you transition from the military to veteran status. The second thing is to help us better coordinate your care as you utilize our community partners and other healthcare systems in providing the care for you. So I appreciate you taking the time to give us some feedback and listen. I will let you know that in the last probably a year, we have been preparing for this implementation. Again, it starts till April 11th, and we have been working with our leaders, with our on the frontline team members, and other folks to really better understand the product, get some training so we can better utilize it, and to create some assessments so that we can meet your needs when you come into the door. We have available for your support as we go through this implementation, because there will be a few adjustments as there is with anything you get new. We have patient advocates. We'll have the VA Health Connect, and we'll have other data and resources that will guide you as we move forward. So thank you for coming. I look forward to this evening's conversation, and I'll turn this back over to Chris.
All right, thank you very much, Dr. Kreisman, for that introduction. Tonight, we're focusing on our federal EHR modernization efforts. To get us started, I'm going to hand things over to Mr. Dan Weir, who will walk us through what this transition looks like. Mr. Weir?
Thanks, Chris. Good evening, and thank you for taking a few minutes to learn more about this important update. I'm going to briefly explain what the Federal Electronic Health Record is. The Federal Electronic Health Record is a single, modern system that securely stores your complete medical history in one place. It connects the VA with the Department of War, the U.S. Coast Guard, and other federal agencies, so your health information follows you wherever you receive your care. Your providers will be able to see your medications, your labs, your allergies, any imaging, and past treatment information, whether those happen during your military service or at a VA facility. Instead of records sitting in a separate system that don't always talk to each other, the federal EHR brings everything together into one secure, unified record, making it easier to share information between the DOW and the VA. It reduces duplicate tests, it streamlines communication among care teams, and it gives providers a full picture of your health history so they can make the most informed decisions. If you're separating from service, your medical information will already be available to your VA providers, so there's no need to hand carry records or restate your full medical history at your first appointment. Second, it supports more efficient visits. When your provider already has everything they need, your appointment can focus on your current concerns and plan of care. Finally, if you move or receive care at another VA facility, your information moves with you. Most of this transition happens behind the scenes, but a few quick steps can help ensure your information transfers correctly. 1. Make sure your correct information, including your phone number, mailing address, and email, are up to date in your VA profile. 2. Check your legal name. Make sure it matches what's on your official ID so records link properly. And 3. If you're transitioning from active duty, confirm that your information is accurate in both the VA and the Department of War systems. You may also see notices about upcoming downtime for certain digital tools. Here are a few key dates. Secure messaging will be unavailable starting April 4th at midnight and will return on April 13th. Online prescriptions refills will be unavailable starting April 7th at midnight and will also return on April 13th. But please note that you can still request refills in person, by mail, or by phone during that time. The automated pharmacy phone system will accept renewal requests until April 6th at 7 a.m. and refill requests until April 10th at 5 p.m. Both services will be back on April 11th. And from April 6th to June 6th, the automated pharmacy phone system will not send prescription reminder calls or text messages. These reminders will resume on June 6th. We understand that any downtime can be inconvenient. To help you stay prepared, a resource guide summarizing these dates and contact points will be available on social media, in the monthly newsletter, on our facility webpage, and at our outpatient clinics. Thank you for your service, and thank you for taking the time to stay informed. If you have questions, please contact 734-769-7100 and request to speak to the Patient Advocate Office. Keep an eye out for the resource guide and key dates and support information. Thank you, and with that, I'll hand it back to you, Chris.
All right, thank you, Dan. That is incredibly helpful information. We'll now take our first question from the audience. And our first question is from Mike. Mike asks, I live up north, but go to Ann Arbor for most things. Will this record change make it easier to get blood work and or imaging at the Saginaw VA or the Clare CBOC? And if any of our panelists want to take that question, now is the time.
Chris, I'm happy to take that question. This is RJ Schildhaus. I'm the Chief of Staff at the Ann Arbor VA. And to answer Mike's question, yes, this electronic health record transition will make things easier for sure. So in Ann Arbor, we pride ourselves on caring for veterans, not just in the Ann Arbor area, but for veterans throughout the entire state of Michigan and Northern Ohio. Who require specialty care services. So this is something we've long waited for. The new health record will allow us to more easily see imaging orders, lab orders, medication orders, and really facilitate care coordination amongst primary care physicians at those outlying CBOCs and specialists at the larger facilities. So yes, this will be a huge advancement that our providers are eagerly waiting for.
All right, thank you very much, Dr. Shieldhouse, for that answer. Our next question comes from Brian. Will the VA please start using our member ID numbers and stop using our Social Security numbers? If anyone on the panel can give us some insight on that.
I can try to answer that. This is Gabe. I'm one of the primary care doctors at the Ann Arbor VA for about 15 years and the Associate Chief of Staff for Informatics. And it will be everyone's kind of used to using their last initial and four to kind of give information. And in the new system, I believe what we're going to be using primarily is your name and date of birth. There are medical record numbers in the new system that you might kind of be assigned and have an ability to use that number instead of your date of birth. But in general, it will be a pretty big change in terms of like how you identify yourself when you're checking in and out of appointments. I don't know if anyone has anything else to add.
Yeah, Gabe, this is RJ again. I'm happy to add to that. So you're correct. My understanding is that at the VA we will use name and date of birth as our main identifiers. Understanding that since we care for many veterans, sometimes they can have the same name and date of birth as a secondary confirmation if necessary. We do plan to use the last four of the Social Security numbers. So don't forget that piece. But you shouldn't need it very often. And you're right, veterans will be assigned a medical record number, but they are not expected to memorize or know that number when checking in.
Okay, gentlemen, thank you very much for those answers. Our next question comes from Daniel, and I should be able to answer this question. What if you go to work for a contractor after military service for the War Department in a combat zone? Are you still eligible for combat-related injuries to be reimbursed through the VA system? And so the answer to that question, unfortunately, is no, not with a contractor. All of your VBA benefits and your VHA healthcare are associated with your Department of Defense or Department of War service. Okay, going on to our next question. In just a second here. Our next question comes from Henry Storm. What issues previously encountered with the electronic health record at other institutions that have gone live have been overcome? And if anyone on the panel would like to answer that question.
I'm happy to try and give that an answer. This is Gabe Solomon again. So I think a lot of you guys have heard that there were a lot of problems with the initial rollout in terms of things like the unknown queue or problems with downtime. But I just want to let everyone know that we were supposed to go live a couple of years ago, but we didn't because all those things were still out there. They've been doing a lot in the last couple of years to address things, especially the downtime and all the electronic errors. And overall, excuse me, I've been seeing a lot better improvement in all the problems that we had before. I'm going to stop.
Okay, Dr. Solomon, thank you for that answer. I just want to remind all of our veterans tonight, if you are joining us by phone and become disconnected, you can call back at 866-641-6898. Again, that phone number is 866-641-6898. There's also an option to stream this event online, and you can access that stream at access.live/Ann Arbor VA. Again, that's access.live/Ann Arbor VA. Our next question comes from Kate, and her question is related to EHRM, and she asks, is this why so many appointments are being canceled? If anybody on the panel can address our ramp down and ramp up process for Kate, that would be great. Thank you.
Yeah, this is RJ. I'm happy to take that one. So As you can imagine, it would be great for us to just completely kind of pause and focus on our transition to the new health record. But, obviously that's not realistic. So we are doing things such as training our staff and, testing some of these interfaces and make sure that everything is ready to go so that when we do flip the switch, so to speak, we can hit the ground running. Unfortunately, that does require us to give providers, a significant amount of time to make sure that they're competent and comfortable and can do that training. And we have had to, move appointments to allow that to happen. Furthermore, when we do make the transition, as you can imagine, if you're running a marathon, you don't start off at a sprint. And so we have what's called a ramp up plan. And the ramp up plan is to allow us to work out some of those bugs or some of those changes in workflow that we expect to experience in the first couple of weeks. I will say that we've taken particular attention to what we consider high-risk services, things that care that is very time-sensitive, and those areas we're doing what we can to mitigate or eliminate even downtime. Think of something such as our outpatient dialysis. That's something, or our outpatient oncology infusions. Those are going to continue without any interruptions. So apologies for if people had to have appointments that were moved, but we're trying to do that to make sure the transition is successful and we can get back to full throttle quickly.
All right, thank you very much, Dr. Shieldhouse, for explaining our ramp down and ramp up process. Our next question comes from Sally, and she would like to know, how will the new system communicate with other VAs? And I think this is a great opportunity to, address that question, but also discuss the VA enterprise as a whole and the efforts ongoing for the entire VA to implement the new EHR.
Once again, this is Artie again. So happy to jump on, and folks, please feel free to add from the team. But with this transition, we are basically going from every VA facility having separate computer systems and computer records that did talk to each other, but talk to each other in a very clunky way, from having one main electronic health record that we're all accessing and all seeing the exact same information. So that infrastructure is going to be the same, but also from the VA's perspective, we're standardizing a lot of the ways in which we do our notes and our documentation and the way that we order medications and labs. So we will be able to communicate not only with our veterans better, and things will seem more seamless when you go to any VA facility, but the information that we're looking at when we talk provider to provider will be more standardized. So it's something we've been looking to do for a while, but this really jumpstarts that effort.
Yeah, and I'll add, we are lucky to be going live as a Michigan market. So Saginaw, Detroit, Battle Creek, Ann Arbor are all going together at the same time. So that makes it a lot easier for us to communicate within the new Oracle health system. And then we also have a system that will allow us to talk to sites that are not yet on Oracle, called JLV. And so we're still able to see the records from any site, regardless if they're on Oracle or our old version of CPRS. But just having the Michigan market go live together will be a big help.
All right, thank you so much for those answers. Our next question is security of the information and protocols being put in place while the records are transferred from CPRS to our new federal EHR. Again, the question is the security of the information and the protocols being put in place while records are transferred from the old record to the new federal EHR.
I can try and take that. The VA takes security very, as a very big issue. I think even more so with the new electronic health record because it's also part of the Department of Defense. So we're taking, essentially extra security because the Department of Defense and VA will now have kind of be all on the same system. So OYT, our Office of Information and Technology, in our security, I know, if anything, I would say they've been strengthened by the transition, but happy to hear what others have to say as well.
Yeah, I would agree, Gabe. And I would say, I'm no OINT expert, but a lot of like the safeguards, the things that we use, our personal identification cards, passwords, the ways our computers are set up. So everything is going to be staying within the VA network. So that transition is all happening already within the VA network. And one thing to add, since the new electronic health record is much more versatile, our old system had a lot of, let's call them like add-on programs or patches and things like that. And I would say that now that we have one product that's going to do all of those things, that puts us in a position where we're less like vulnerable from potential software issues from vendors and things like that. So I do see this as an improvement as well.
Just to add on to what Dr. Shieldhouse and Dr. Solomon said, this is Dan Weir. The fact that we are now we are going to be a joint record with the Department of War. Several of our staff had to undergo level 3 security clearances. So yes, the fact that it's with the DoD heightens the security than it even had before. But yes, it's going to be very secure, and they had, like our query authors, for example, had to undergo a level 3 security clearance due to the data that they would be using, since it's both VA and DOW information, excuse me. Thanks.
All right, thank you very much, Dan, for that answer. We're going to give our panelists a quick break here and ask our first poll question. We've heard a lot of great questions tonight, and we encourage everyone to please keep them coming. Our first poll question tonight: what is your biggest concern about the federal EHR transition? Press 1 for data privacy and security. Press 2 for appointment disruptions. Press 3 for delays in accessing results, messages, consults, and/or pharmacy orders. Press 4 for staff learning curve, and press 5, difficulty using MyHealthyVet. Again, that question is, what is your biggest concern about the federal EHR transition? Press 1, data privacy and security. Press 2, appointment and disruptions. Press 3, delays in accessing results, messages, consults, and/or pharmacy orders. Press 4, staff learning curve. Press 5, difficult using MyHealthyVet. And for those of you streaming this call online, you'll find the poll just below the display. We'll give everyone about 30 seconds to 1 minute to put in their answers. We can see those answers populating now on our interface, and we will read those results here in about 35 seconds. Again, the final time on that question: what is your biggest concern about the federal EHR transition? Data privacy and security, press 1. Appointment disruptions, press 2. Delays in accessing results, messages, consults, and/or pharmacy orders, press 3. Staff learning curve, press 4. Difficult using MyHealthyVet, press 5. And again, if you are streaming this call online, you'll find the poll just below the display. And we appreciate all your responses. Your feedback helps us understand how to best support you during this transition. Please keep the questions coming. We're here tonight to listen to you and address your concerns. As a quick reminder, we are going to read those results. So the number one concern is delays accessing results, messages, consults, or pharmacy orders. That garnered 29% of our answers. Coming in at number two was data privacy and security. That was 27% of our answers. And number three was difficult using My Healthy Vet, which brought in 27% of our answers. Again, the number one concern, delays accessing results, messages, consults, and pharmacy orders. Number two was data privacy and security. And number three is difficulty using My Healthy Vet. We appreciate all of your feedback. As a quick reminder, if we don't get to your question tonight, you will have the opportunity to leave a voicemail at the end of this call, and someone will follow up with you. We're now going to jump back into the Q&A, and we encourage everyone to continue putting their questions into the chat. All right, so our next question comes from Steve, and Steve asks, I get my care from VA Ann Arbor and from the University of Michigan Hospital. Will this new system be able to talk between the two healthcare systems? Again, the question is, I get my care from VA Ann Arbor and the University of Michigan Hospital. Will this new system be able to talk between the two?
I'm happy to try and take a first stab at that. So the U of M system is on a different type of electronic health record called EPIC, while we're going to one called Oracle/Cerner. So they don't have a direct connection like they would if we were all on the same electronic health record. So we're kind of used to this because that's the way it is now. I know there is a interface that we can access that will allow us to see records from various community hospitals and partners, and that's called JLV. And University of Michigan just became one of the institutions that is in our JLV. So we'll be able to easily look and see the records more easily than we have in the past. But we won't be able to directly interface with their system and vice versa, such as like ordering things or directly looking into a chart. But the records should be summarized for us in our JLV system. So it should actually be a little bit better than what we've been used to.
All right, thank you, Dr. Solomon, for that answer. Our next question, is there a link between community care and the VA so if there is an emergency, records are quickly accessed? Is there a link between community care and the VA so if there is an emergency, records are quickly accessed?
Yeah, I can take that one, Chris. So I was just going to say, folks may think of community care as separate from the VA, but the community care team and the community care service is embedded within the facility. So we are truly one team. Particularly here in Ann Arbor, the community care department does report up through me, and that's truly helpful. So I think that when we do have veterans who utilize their VA benefit in the community, we have a team of people waiting to get the records back from those providers. And once those are received, they are uploaded into the VA electronic health record where the providers can see them. So there is a lot of coordination in that regard.
All right, thank you very much, Dr. Schildhouse. Our next question, the VA is greatly appreciated. Will outside doctors, such as community care, be able to see and access records with ease? And are prescriptions stopping on April 8th for a week? So two very important questions there. I think actually let's first address the prescription question. So that question again is, are prescriptions stopping on April 8th for 1 week?
I can take that one, Chris. So The online prescription refills will be unavailable starting April 7th at midnight and will also return on April 13th. But please note that you can still request refills in person, by mail, or by phone during that time. The automated pharmacy phone system will accept renewal requests until April 7th at 7 a.m. and refill requests until April 10th at 5 p.m. Both services will be back on April 11th. So I believe that is mostly true.
All right, thank you, Dan, for that answer. Again, just to reiterate that the ability to order prescriptions online will be briefly paused. However, you will still be able to get all of your prescriptions either over the phone, by mail, or in person. So the ability for you to access your prescriptions will not stop. Okay, our next question comes from Joe. Is secure messaging staying, or is it getting temporarily shut down for the time being?
I think the answer to that one is a little bit of both, but for the most part, it's staying. So that was one of the good news that we recently found out, that from the patient perspective, secure messaging will be the same as it has been. You'll be using the same interface. You'll be able to send messages the same way, and the majority of the function, I believe almost all of the function, will be exactly the same as it was before go live. On our end, as providers, we're going to be using secure messaging less and using the Oracle inbox, but they have a direct connection. So when you send a secure message, it will come to my inbox in Oracle, and I'll be able to reply to you just like I would in secure messaging. So there is a temporary, like Dan just mentioned, and Dan can give the specifics again on when it will be down, because that is really important. But there will be a downtime for a couple of days while we're transitioning and migrating all of this information to the new system. But I believe you'll still be able to see your records in secure messaging. You'll still be able to do messaging. You could ask for medication requests, etc., like you do now.
All right, thank you very much, Dr. Solomon. Our next question touches on EHRM and artificial intelligence. Does the VA have in place any AI software with EHRM changing? And if so, will AI have strong oversight? Again, the question is, does the VA have in place any AI software with EHRM? And if so, will AI have strong oversight?
I can answer that one. Okay, you go first, Gabe.
Oracle is in the version that we're getting does not have a lot of AI built into it. So I know that Oracle is a big software company that has aspirations to have like more AI built into the healthcare record, but it's not ready in the current state. So I know the one that we're getting does not have AI built into it. The VA in Ann Arbor is interested in using AI, but also wants to be cautious about it. We have an AI oversight committee, and we have not been using any AI that's kind of outside, that has not been any part of the electronic health record to date. There are some pilot programs that we might be able to sign up through Oracle that would use things like ambient dictation, which would help kind of providers and patients in their visits with having to do a little bit less typing and a little bit more time, like spending time with patients and listening to patients. So I know all of us in primary care are interested in this. The big VA has a pilot program that's going on, but it's a system that operates outside of the electronic health record and is highly regulated, both internally to our VA and at a federal level. So I do think probably that's the future of electronic health records, is to incorporate AI. I know Oracle would like to do this in the future, but it's probably a couple years away.
All right, thank you very much, Dr. Solomon. We're going to move on to our next poll question. And again, we will ask this question, and you will simply just tap the number on your phone that best corresponds to your answer. The question is, how comfortable do you feel using online tools to manage your health care? Very comfortable, press 1. Somewhat comfortable, press 2. Neutral, press 3. Prefer limited digital use, press 4. Prefer non-digital use, press 5. Again, how comfortable do you feel using online tools to manage your healthcare? Very comfortable, press 1. Somewhat comfortable, press 2. Neutral, press 3. Prefer limited digital use, press 4. Prefer non-digital options, press 5. And if you're streaming this call online, you'll find the poll just below the display. The question again is, how comfortable do you feel using online tools to manage your healthcare? Very comfortable, press 1. Somewhat comfortable, press 2. Neutral, press 3. Prefer limited digital use, press 4. Prefer non-digital options, press 5. We'll give this question about 15 to 30 more seconds, and then we'll let you know what everyone is thinking. And final time on that question, how comfortable do you feel using online tools to manage your healthcare? Our number one response was very comfortable at 34%. Our second response was somewhat comfortable at 29%. And our third response was prefer limited digital use, coming in at 15%. How comfortable do you feel using online tools to manage your healthcare? Very comfortable at 34%, somewhat comfortable at 29%, and prefer limited digital use, coming in at 15%. We're now going to move on to our next Q&A session, another set of questions here. And our question is, in regards to specialty care, if there is a process or agenda in place to improve turnaround time for specialty care and operations. Again, the question is, in regards to specialty care, and if there is a process or agenda in place to improve turnaround time for specialty care and operations.
I could take that one, Chris. I mentioned this before, but particularly at the Ann Arbor VA, we pride ourselves in all the care that we deliver, but the one of the critical services is our specialty care, we service over 80,000 veterans a year, and about half of them get their primary care at another site and come to Ann Arbor for their specialty care. So we're very in tune with this, and I think that our wait times are something that we're always looking to improve. Oftentimes it's providers with full grids and full clinics, and sometimes we just need more space or more great people to make it happen. We are hopeful that after we get through our ramp up, that the electronic health record, a big part of it is simplifying the way that we do scheduling and allows us to be more flexible. So we're hoping that there are some efficiency gains that veterans would see as a decrease in wait time. But outside of that, it's really other measures, the ability to hire, the ability to have clinic support staff that really drive our ability to make improvements in turnaround time. Also, some specialties are very hard to recruit for. We're doing everything we can to be competitive, and in most instances, we are able to beat the wait times that veterans experience, even if they do utilize community care.
All right, thank you very much, Dr. Schildhouse. Our next question, will this transition, as in EHRM, our transition to EHR, will this EHR transition actually improve care at the bedside? This veteran has concern that it will impede the provider with delivering good care while having to learn the system. Again, that question is, will this EHRM transition improve care at the bedside? The concern is that it will impede the provider with delivering good care while having to learn this system.
Chris, I'd like to take a attempt at this one real quick. Thanks, Gabe. The answer is no. The type of care you're going to be receiving won't change. It's the way it's charted in a new federal electronic health record system, which is going to be cataloged and organized in a better way that follows you throughout your entire career. Now, we've been preparing for this for a while. We're getting ready to undergo a multitude of learning labs to help the staff become more confident in the system. We've completed all of our end user training. Our site has a 95% approval rate, and that's not just Ann Arbor, but that's the entire Michigan market. I know from the education we've received that we're ready and competent to perform what actions need to be done in the federal electronic health record. But overall, your type of care will not change. It will be improved. Thanks.
Yeah, I agree with Dan. And, I think each area of the hospital is a little bit different from kind of what we've learned from other sites. Certain areas really actually gain efficiency. I think in particular, the emergency department and the inpatient side of things in general get back up and running very quickly. Where other sites have gotten a little bit more trouble is in the outpatient setting, but we have really truly done our best to get everyone trained up and ready to use the system. In general, people are pretty excited to use the system, especially as we get closer. And so I do think in the very beginning, it's inevitable. There's going to be a little bit of a learning curve and slowdown primarily in the clinical area, outpatient. But I think that will hopefully be short-lived. And then after a couple of weeks, we'll get back up and running, hopefully better than we were before.
All right, thank you very much for those answers. Our next question. I served in the military in the 1960s. Does this new system integrate my service medical records? If it is, will I have access to them? I know that my current medical records are in the National Archives now. Again, that question, I served in the 1960s. Does this new system integrate my service medical records? And if it does, will I have access to them? I know that my medical records are currently stored in the National Archives.
I truly don't know the answer to that. I don't know if any of the other panelists do. I know probably, we are going to be integrated with the Department of War. So I know they have not been on an electronic health record since the 60s. So there's probably a lot of stuff that's on paper that my guess is would not be part of our viewable electronic health record. But I'm not 100% sure on that.
Yeah, Gabe, unfortunately, I'm not, the DOW process for, integrating old records. I think to answer from the VA perspective, so our current electronic health record, which is called CPRS, that system with our transition is not going away. So it will be available to us as providers in what we call read-only mode. So there will be a time when we have to reference that, as you can imagine, within the first couple of weeks, months, and couple of years. We will need to reach back and look at it. But as time moves on, that will become less relevant for current healthcare needs. So, and if folks are worried, this is a similar transition. I know Dr. Sell and myself are University of Michigan staff. We went through a transition with them years ago with this dynamic, and I can say that it's not too difficult for us to navigate.
All right, we're going to take one more question here before we get to our final poll question. And the question is, how did the VA come to the decision of using Cerner versus Epic 2? How accessible is this, and is ID.me still a prominent feature? Again, the question is, how did the VA come to the decision of using Cerner versus Epic? How accessible is this, and is ID.me still a prominent feature?
My guess is that the main reason that we decided to go with Cerner is that it's what the Department of War, Department of Defense has been using, and so it makes for a seamless record. So it kind of makes a lot of sense to keep both of those enterprises on the same system. From selfishly, since kind of U of M uses Epic, in a way, it would be nice if we were able to communicate with our university partner more easily. But I will also just say, we do share a lot of residents with the university. And so in a way, it's also advantageous for them to be able to practice on Epic and then come to the VA and be able to use Cerner Oracle, and then they'll be more prepared. So we're kind of looking at it as positive, but I think the main reason is just that lifetime medical record with the DOW.
All right, and just to add to that about the ID.me and login.gov, everyone should know that we have specialists here at the Lieutenant Colonel Charles S. Kettles VA Medical Center in Ann Arbor who can provide one-on-one assistance to any veteran who is having issues accessing ID.me and login.gov. Again, those two applications help you log into your VA mobile app. And so if you're having some issues or concerns about getting an ID.me account or login.gov account, I encourage everyone to visit us here in Ann Arbor, right in the Welcome Center when you walk in the glassed off area to the right, and that is where our My Healthy Vet team sits. They travel frequently to different CBOCs, so not always that you would have to come to Ann Arbor, and I encourage you to follow us on social media as we do post our schedule when they'll be in your neighborhood. All right, we're going to go ahead and move on to our third poll question, and this is our final poll question for the night. Again, this town hall wraps up at 7 o'clock, so we have about 15 minutes left. The question is, how would you like to receive updates about this transition? Monthly newsletter, press 1. Social media, press 2. Facility website updates, press 3. In-person updates and visits with your primary care provider, as an example, press 4. Or mailed letters, press 5. Again, the question is, how would you like to receive updates about this transition? Monthly newsletter, press 1. Social media, press 2. Facility website updates, press 3. In-person updates at visits, press 4. And mailed letters, press 5. For our online participants, the poll is located just below the display. And we'll give everyone about 40 seconds here to answer this question, if they so choose. We want to thank everyone for their participation tonight. Your questions and responses help us better understand your healthcare concerns and what matters most to you. And it looks like our responses are starting to slow down a little bit. So again, the question was, how would you like to receive updates about this transition? 35% of you said monthly newsletters. That was our number one answer. Mailed letters actually came in at 37%, so that's our number one response now. And our third answer was a combination of social media and facility website updates. So again, most of you are responding that mailed letters are your preferred contact method for the EHR transition news. Monthly newsletters are the second most prominent at 36%. And now our third most prominent answer is facility website updates. We're going to do another about 10 to 12 minutes here of Q&A from our veterans here on the call. Our next question is, will there be something similar to non-VA providers, such as MyChart, that lets us have faster access to lab, imaging, and test results? This veteran says that they can literally be in the ER and re-adding their lab results in real time to prepare questions for their ER doctor. Currently, the veteran says that VA results are posted days or weeks later. So again, that question, will there be something similar to non-VA providers that lets us have faster access to lab, imaging, and test results? That is the question, and seeing if the VA is able to more quickly get our test results out to our veterans.
From my understanding, secure messaging is kind of like our version of My Healthy Vet. There has been actually a push in the last several months to make the information get out to patients more quickly. I believe labs, studies, procedures, as of even right now, I believe, I don't want to speak incorrectly, but should be posted within about 24 hours of them being resulted. I don't think it's real time like U of M might be, but I think there's a push to get as much information as possible to the veterans as quickly as possible. And I agree with it. I think that's the best thing for care. So I believe you'll be able to see your lab results or x-ray results or any of your other studies in My Healthy Vet within 24 hours of them being resulted.
All right, thank you very much, Dr. Solomon. We're going to ask a question again, and it's one of our more popular questions, so I know we touched on it here at the beginning of the call, but I think it's very important based on how many times we're seeing this particular question screened and posted. Is this question, again, is the Oracle program, the new federal EHR, only within the Ann Arbor VA? How will it affect families when you go to other VA facilities throughout the U.S.? Again, how will the Oracle federal EHR program, and is that only within Ann Arbor VA? How will it affect families when you go to other VA facilities throughout the U.S.?
Hi, Chris. I'll take a stab at part of this, and perhaps the others can answer it. But this program is already available in 6 facilities on the West Coast. We will be come April 11th. It will be going open in the Michigan market. So ourselves, Detroit, Saginaw, and Battle Creek will have the same program. And subsequently, 2 months later, we'll see some of the folks in the south of Ohio come up. And then also 2 months later in Indiana and 2 months later in Cleveland. So it's going to spread fairly quickly if all goes well. And then the secretary has indicated that he wants to accelerate, if all's going well, he wants to accelerate the implementation and have all facilities up and running within 5 years. So across the nation and into our other spaces out there. And so, it will be eventually, but it's going to be a slow progress. But as I believe Dr. Schildhaus indicated earlier, we will still have access to what is happening in CPRS. And then we'll be able to, maintain, because we have many veterans that travel between different facilities, and we need to keep that continuity of care and service to them. And I'll defer to the others.
Yeah, so just to chime in, agree with everything that Dr. Kriesman has said. I think part of the reason why all 4 Michigan market sites are going live at the same time is thoughtful, because so much of that care is shared between those sites. So we're actually really excited to have those sites going live with us at the same time. But yes, as during this transition period over the next 5 years, veterans can definitely go to any VA facility for care, and they will be using one of those 2 systems. And then, as Dr. Solomon mentioned, there is this platform called JLV, which allows us to view records that are at the site that are at or within the electronic health record that VA might not be using. Also, one important point, we still do have the ability to send referrals or requests for labs or imaging through to sites, both Oracle Cerner or CPRS, through a mechanism called an interfacility consult. So we do have the ability to talk between these sites. It's just it is a little clunkier, so we're excited for everyone to switch over.
All right, thank you very much, Dr. Schildhaus. We have time for about 2 more questions here. Again, this town hall will wrap up right around 7 o'clock. And the question, again, there's a lot of pharmacy questions here. Will the Toledo VA clinic pharmacy be affected by this? I get my meds mailed from there. So again, this question from the veteran, will the Toledo Pharmacy VA be affected by the EHR transition? I get my medication mailed from there.
Yeah, so I'm happy to take that one. Um, so, so the Toledo CBOC, as part of the larger VA Ann Arbor healthcare system, is going, live at the same time. And their pharmacy, I mean, our pharmacies are the same. We share processes, we share staff. So there should be no interruption for our Toledo veterans with the pharmacy services that they get outside of what's already been outlined with that transition. The only thing that veterans may see, and probably the most common thing that they'll see, is there is some difference in capabilities between the two systems with using like what we call half-tab prescriptions, where it may tell a veteran, they take one 10-milligram tablet and cut it in half and take that. So you may see your prescription, how it's written, change, but it will stay the same.
All right, thank you very much, Dr. Schildhouse. We are on our final question tonight. We want to thank everybody for their participation. We have dozens and dozens of questions to answer. I want to remind everybody that if your question was not answered on the phone tonight, someone will be reaching out to you to answer your question after the call, probably into the next couple of business days. The final question comes from a veteran. He says, I am 104 years old and my wife is my caregiver. Is there any payment provided for that? Again, this question from a veteran named Marvin. He says, I'm 104 and my wife is my caregiver. Is there any payment provided for that?
I'm happy to take that last one. So, what I would recommend is to contact your primary care team has a social worker as a part of that team. There are a number of flexibilities for veterans to get help at home through what we would call home health aid services or skilled nursing services. And there are some things that the social work team can explore. We have what's called a caregiver support program, where in lieu of you have to determine eligibility, but where family members can get compensated to care for veterans. There are a number of other programs that have varying kind of processes to align resources at home that involve family.
All right, thank you very much, Dr. Schildhouse, and thank you to Marvin. It's rare that we have a centenarian on here, so we're very happy to still providing the care that veteran has earned and deserved. We are officially out of time for tonight's event. Thank you so much for spending your evening with us. We truly appreciate the thoughtful questions and comments we've heard tonight. Your participation helps shape how we provide care and support to veterans, and it means a great deal to us. If you didn't get a chance to ask your question, don't worry. Just stay on the line after this and leave your name, phone number, and your question. A member of our team will follow up within the next week or so be sure to leave your contact information. You can also visit our facility events page or follow our social media channels for more information. We'll be posting a helpful resource guide as well as the results of tonight's poll's questions. Once again, thank you for spending your evening with us. We appreciate you, we hear you, and we're here for you. Please stay on the line if you'd like to leave a message. We look forward to connecting with you soon, and have a great evening, and thank you for your service.